Hey everybody, John Malanka with United Patients Group. Be informed and be well. This segment is brought to you by Aspen Green. Aspen Green is just a handful of USDA certified organic hemp and CBD brands, and all of its hemp is grown from the perfect topography and climate found in Colorado. Check out why purity matters at aspengreen.com and follow them on social channels at Aspen Green CBD. Use promo code UPGCBD for 20% off. Hi everybody, John Malanka here with United Patients Group. Be informed and be well. I have a special guest, old friend, dear friend, Dustin Sulak, Dr. Dustin Sulak. And so, hey Dustin, how are you doing? Good to see you as always. I'll read his bio here, but I just wanted to, before we start, he's a humble guy. I'm gonna shine the light on him a little bit because I know he won't say that. There's some great doctors in this industry, especially when, Dr. Meshulam, I'll throw with Dr. Lead with him, but Dustin is going to go down in the history books as one of the top minds in the cannabis industry, as well as health and wellness, but cannabis industry. And so you're going to learn a lot today. And again, Dustin, I thank you for being part of this industry, raising the bar for professionalism in this industry as well. So thank you for being with us. And let me go into this impressive bio. So Dustin Sulak, DO, he's an osteopathic physician licensed in Maine as a general practitioner. He's an expert in integrative medicine, the intelligent combination of conventional and alternative approaches to healthcare. He has long been fascinated by mind-body medicine, spiritually and healthcare, and natural approaches to promoting health as well as healing. He's an expert in cranial and biodynamic osteopathy. I'm going to tongue twist your title quite a few times. A clinical hypnotherapist, Reiki Sensei, practitioner of Qigong as well as yoga, and he has studied with numerous conventional and alternative healers as well as physicians. Dr. Sulak's clinical practice focuses on treating refractory conditions in adults as well as children. He received an undergraduate degree in nutritional science and biology from Indiana University, a doctorate of osteopathy from the Arizona College of Osteopathic Medicine, and completed an osteopathic internship at Maine Dartmouth Family Medicine Residency. Dr. Sulak is the founder of Integrate Health as well as Healer.com, a medical cannabis educational resource. He is a passionate teacher of clinicians. He is a passionate teacher of clinicians, patients, and industry professionals, and sits on the board of directors of two nonprofits focused on cannabis education, the Society of Cannabis Clinicians, as well as Patients at a Time. And I'm going to add, he's an advisory board member of United Patients Group as well. So Dustin, good to have you on the show here. How are you doing?
Thank you, John. I'm doing great. It's a beautiful day and wonderful to have another opportunity to work with you to help reach people and educate. Thank you for the opportunity to do what is most important to me.
I appreciate that. We've done a lot together, and I always talk about the ripple effect of education, throwing the pebble in the pond and it goes out and out and out. And I think that's one thing that makes you very special is that you're a great educator and very knowledgeable with health in general, but also cannabis. I wanted to make this just an open conversation. Cannabis is not a one size fits all, but you've spoken about it as a daily, something for prevention as well as daily wellness. And so can you talk about this? Because there's still, we're 2020 now. When Corinne and I entered this industry in 2011, the walls of the stigma were high, and they're starting to come down, but they're still up here, and it hasn't been accepted by a lot of doctors, a lot of medical institutions, a lot of governments, as well as a lot of patients. And so I think, actually, I know the information that we share really trickles out. You've been at our conferences, and I've had patients that have come in there with their arms crossed saying, no way, what am I going to learn from this guy? And they go out of there going, how do I get some cannabis now? And so you talk about the benefits. I don't want to say you're the pusher on there, like, here, try this, but no, you'll see what I'm talking about, everyone. So can you talk about the cannabis plant, why human bodies, what the endocannabinoid system is, and then how it brings the body back to balance. And one of your great descriptions that I use all the time, and I've used it on the show quite a few times, and have given you credit, of course, is the breathing, to see where you are. in balance as well as in pain, and then incorporating medical cannabis into that. So welcome, Dustin.
Thank you, John. Well, I think in some ways it makes a lot of sense to think about prevention. You and I and lots of the viewers are interested in staying healthy and feeling our best every day. But if you look at our medical system right now, that is absolutely not the priority. And I'll, in all fairness, public health and preventative medicine isn't just based on the healthcare system. It requires cooperation from agriculture and the food industry and many other facets of society. But in general, here in the US, we spend more per capita on healthcare than any other country in the world, and consistently rank the worst out of our peer countries in terms of our health outcomes. And the main reason for that is because we're spending all our money waiting until after people are already very sick and then aggressively treating them with expensive treatments that don't produce a cure, but they just manage the disease. And then we also spend an immense amount of money at the end of life, keeping people alive in the ICU for days or weeks and so forth. So, while it's obvious to some of us that prevention is a very important topic, it's overlooked drastically in our current system. Now, in my practice, I'm mostly seeing patients that have been through various other specialty fields of medicine. They've seen the pain doctor, they've seen the rheumatologist, maybe they've seen the oncologist, the neurologist, whatever it is. They don't get results there. They come to me, and with cannabis and a combination of usually some other integrative treatments, we see incredible results. Like still 10 years later, I'm like kind of pinching myself like at lunchtime. Wow, 4 patients this morning are just like life-changing, miraculous results, and the rest of them are interval improvement. I have to think if cannabis can do so well for treating these highly complex refractory conditions that don't respond to the rest of conventional medicine, then what could it do to help prevent these conditions in the first place, right? It seems like a very logical question. And then it becomes even more logical because we know that one of the main ways cannabis is affecting us is by interacting with the endocannabinoid system, which is an integral part of our capacity to stay healthy. So the endocannabinoid system, for people that are new to this, is a signaling system in the body that's present everywhere. So all the organs, tissues, glands, wherever you look, you can find the endocannabinoid system, and its main function is homeostasis, which is the ability for a cell or an organ or a tissue to have a stable and healthy internal environment despite fluctuations in the external environment. So it's a method for adapting to life, for adapting to stressors from our environment, for adapting to injuries and healing from injuries. So now we've got this incredible medicine for treating really severe conditions. We got this physiologic system that's designed to keep us healthy. And when I say designed, I mean it evolved over millions of years. The endocannabinoid system is present in really simple chordate animals. So like if you look at a sea squirt, okay, the sea squirt has a CB1 receptor, a cannabinoid receptor that's almost identical to the human cannabinoid receptor. This means that a long time ago, endocannabinoid physiology became an important part of animal life. And it's been that way ever since, about 600 million years, according to the scientists that do that comparative research. So this is nothing new. This has been keeping us healthy for our entire life, since before we were born till our very last breath. Endocannabinoid system is important. And then, I think the third thing that brought me to this is that I'm treating people with cannabis, and I was curious to know, what are the effects of long-term cannabis use? And I really dug into literature to find out, like in the general human population, are cannabis users more sick than non-users? If we look at rodent toxicology studies, are the rodents that get the highest doses of cannabinoids for the longest period of time, are they sick or are they well? What I found was amazing. Like, so if you look at those toxicology studies, these are mice and rats that got incredible doses of THC every day for 2 years. They have less of every type of tumor. Their weight is more normal. Their metabolic function, like they're healthy, and so I think that's how I got started on this idea, and just dug into the research. And I'll pause for a moment here, but I'll share some of what I found.
No, I think this is great. So you're saying everyone should just blast themselves as many cannabinoids as possible to stay healthy, and this might be a better, calmer world. I
You
mean,
know, I
sounds like the
no
rats,
that you
the
know
rodents.
that's an oversimplification, and thankfully not everything that is present in rodents translates to people. But I think it was Carl Sagan, the astronomer, right? The famous astronomer. He says the illegality of cannabis is outrageous. I got this quote here: an impediment to full utilization of a drug which helps produce the serenity and insight, sensitivity, and fellowship so desperately needed in this increasingly mad and dangerous world. And that was, I think, late 60s, early 70s. It's never been more true. And so I think the social and spiritual aspects that cannabis can bring to one's life are pronounced, in my opinion, in terms of cannabis use for prevention. We know even before COVID, we know that social isolation is associated with much higher rates of heart disease and stroke and depression and other mental health illnesses, obesity, overweight, like sleep disturbance, all that stuff. We are designed to be connected to each other and to be connected to something greater than ourselves, whether you call that nature or God or whatever. And cannabis really can facilitate that. But beyond that, there are some very specific associations between cannabis use and better health outcomes. And I think the most obvious is if you look at diabetes and obesity.
Yeah.
So this is, unusual because in a big population, this is statistics here. This doesn't mean it's for sure this way for any individual. But if you look at the big population, cannabis users consume more calories, but they're much less likely to be overweight, to be obese, and to have type 2 diabetes. Much less likely.
I've heard that study for years now. And how is that possible? Because you mean the picture is use cannabis, you get couch locked, and you're sitting there eating. I think Corinne tried cannabis once in her life before she became ill, and she goes, "Oh, I won't do it because I ate the whole household," And so, so what do you explain that? And you brought up diabetes, and the very first, you and I met at Mary Lynn's Mathery Patients at a Time in Oregon. The very first one that I attended, and Corinne and I attended, was down in Arizona, I think back in 2011. And it was mind-blowing to meet all these medical experts, physicians that were talking about cannabis and different ailments. And this has been their life study. And one doctor, I believe from Italy, came in and spoke about diabetes. And my father had diabetes. He was a healthy diabetic, if you can be a healthy diabetic. But it affects everything, and he had passed with a heart attack. But I remember sitting there with Corinne, sitting back and listening to this doctor and hearing him talk about the benefits of cannabis and what it does for diabetics. I remember just tear went down my face, and I said, God, what could I have done for my father? Would this helped my dad? I went back and shared this with my mom as well. But cannabis didn't mean to take you away from the obesity and diabetes.
No, this is extremely important. I mean, so many people are dealing with this right now. It's about 40% of adults in this country have obesity. And in addition to that, 32% are overweight. So almost 3/4 of the people have some metabolic disturbance, and almost 11% have diabetes. It's these numbers are really impressive. And previously, the data about cannabis and obesity and diabetes was cross-sectional, which means we can just take a snapshot of the population, look at cannabis users versus non-users and the rates of diabetes and obesity. And yeah, we see lower rates in cannabis users, but we don't know that cannabis is causing that. Maybe people that choose to have cannabis in their lives are more likely to be vegetarian or vegan, or maybe they're more likely to go out dancing, or who knows, right?
Go do something like that. I mean, I think it's just the way we eat. Living overseas and coming back over here to the States. I mean, overseas, a family of four would eat this. a person here in the States, a
Eats
family
the
of
whole
one,
thing. Sure,
you
sure.
know.
And, and I think it's part of our culture where people are essentially living to eat and not eating to live. It becomes this big important thing in life. And I'm all for thoroughly enjoying food. I think it's a wonderful source of natural pleasure. But getting back to the data later, now we have longitudinal data. So if you look at like we have cohorts of people that we followed from age 7 all the way to their middle age, and we can see that as they start using cannabis, their likelihood of having diabetes or obesity is going down. So there is, again, that doesn't prove that it's causal. There might be some intermediate factor that's kind of mediating that relationship, but it seems causal, and it seems that even more so that cannabis is responsible for this preventative effect on obesity and diabetes, because you can give it to rodents while you give them an obesity inducing diet and they do not become obese. Not only do they fail to become obese, the bacteria in their gut doesn't change to that of an obese mouse. So this is, a very big new field in medicine. Everybody's looking at kind of
Wow.
the biome, the
Yeah,
microbiome, right?
wow.
And you can, I mean, this sounds disgusting, but you can do fecal transplant from a skinny person to an obese person, meaning you take the bacteria from the skinny person's gut and put it in an obese person's gut. If that sets up shop in their intestine, it actually changes their metabolism and it makes them lose weight or less
Are
likely to
they doing that
continue to.
now?
Just in research, not
Uh-huh.
not clinically, not
Yeah.
therapeutically. No, I mean there are some scenarios where they are doing fecal transplant for GI, other GI
Yeah.
infections and
Yeah,
GI
but it
illnesses.
makes sense, though. It really makes sense. I mean, everything stems. There's a great documentary called The Second Brain, the brain, of course, and the
Yeah,
gut, the second brain. Some people would say that would be the first brain. But everything stems from it. How many times have we eaten something, eaten too much sugar, eaten too much, butter, whatever, and you're off. You're like, okay, and you're off for a day, especially if you have a clean system.
for
But
sure.
everything stems from the gut. Um, well, let's talk about wellness and well, let's actually. Can you go back on the study with the diabetes? Can you talk about cannabinoids? I would
Yeah,
say,
sure.
you always hear from 120 to 160. Where are you in that cannabinoid number?
Oh man, I think it's I think Lumir Hanous out of Israel's, I kind of trust where he's at, and I think it's 160 according to
That
him.
that that, that way.
But I'm not an expert on all these tiny little variants of the molecular structures and
Yeah, and
what
more
that
are being
really means.
discovered each and every day. And so, for our listeners that are new to this, cannabis has 160 different cannabinoids. One cannabinoid that you're probably familiar with is THC is a cannabinoid. What we're seeing everywhere now is CBD is another cannabinoid, CBN, and each one of these 160 different cannabinoids have their own purpose in the body of what they do. One helps with sleep, one helps with inflammation, one's a cancer fighter. And so, can you talk about that, Dustin? What were you seeing in these diabetic studies of what type of cannabinoids? I always hear THCV is in Victor, is does help with diabetes, but a lot of these cannabinoids aren't really easily accessible, are they?
Sure. Well, I think the majority of the evidence for cannabis having a preventative effect on diabetes and obesity has directly to do with THC, which
THC,
is
okay.
THC, and same with the rodent studies, THC. Now, THC is the best painkiller in cannabis. It's the one that causes kind of the spiritual and psychoactive effects and has many other benefits. It's a powerful part of cannabis, but many of the other components of cannabis could or are useful in the prevention of these metabolic illnesses. And CBD is one. CBD seems to improve metabolism and it can curb appetite. THCV, which you mentioned, is probably the best candidate just based on its effects. So, this is interesting, a small tangent, but in medical school, I heard about the endocannabinoid system twice, both in pharmacology class. Once was talking about the drug Marinol, which
Yeah.
was a synthetic version of THC, and the only mention was that it targets the CB1 receptor. You know, every drug, we need to know its mechanism of action and memorize it and spit it out on a multiple choice exam. The other mention was something called rimonabant, which is the anti-munchie drug. Rimonabant is a CB1 blocking drug. So it essentially does the opposite of THC. It totally blocks that receptor, but it also blocks the receptor from our endocannabinoids. It's basically a way to shut down the endocannabinoid system. And they were saying, well, this is a CB1 blocker, and this is going to be the best solution for diabetes and obesity because it's the anti-munchie drug. And it looked really good in rodent studies, except they approved it in Europe, unfortunately, before they did in the US. I say unfortunately that it just got approved at all because people that were taking it developed severe mental health issues, including a high rate of suicide, because you cannot block this CB1 receptor and expect things in the body to function normally. What's beautiful about THCV is that it very gently blocks that receptor only if it's overactive. So it doesn't like take its activity and reduce it down to normal, but if that receptor is getting excessive activity, it doesn't reduce it down to zero, it reduces it to kind of a normal state. And that's one of the benefits of THCV. And I think breeders are really working to create more varieties of cannabis that have THCV, and you're starting to see some of that on the market.
Are you seeing it out there? Because, you know, here in the San Francisco Bay Area, a patient watched one of our videos and it was discussed. And I only found one company that was selling a tablet with it, and that you can't, you know, currently it's not easily accessible to find, you know, a tincture or.
Yeah, it's still pretty rare. We see varieties from time to time that have 1 or 2% THCV, not a strong amount of it, but I don't know that you need a lot of it. But what's beautiful is that THC can do something very similar, and this is why it's working. When we so our bodies make endocannabinoids. These are compounds that act so much like THC. It's incredible. Like their physiologic activity is very similar. The main difference is when we take THC into the body, it kind of has this global effect everywhere, versus in our own physiology, endocannabinoids are very precise. So make a little in the brain and then it gets broken down. Make a little in the heart or wherever, you know, it's very specific. But people that are obese, those fat cells are producing excessive amounts of endocannabinoids to the extent that it can downregulate one's endocannabinoid system, meaning build tolerance to endocannabinoids. So it'd be like someone who's smoking joints all day and never gets high because they have so much THC in their system and they just don't feel it anymore. They've downregulated the function of that system. Same thing happens in obesity. And so if that's occurring, when THC comes in there, it can disrupt that and actually restore the receptor activity to its normal level. So in some ways, THC can work a lot like I was just describing THCV. And I think there's a lot of other benefits with it as well. People tend to sleep better. And of course, disturbed sleep not only is a risk factor for obesity and diabetes, but is a risk factor for cardiovascular disease, for stroke, for mental health, for arthritis, for pretty much asthma, you know, everything, right? And I think we should just start there. Our society is terrible at sleeping. You know, now everybody's up on their screen all night, and it's crazy.
Affected my eyesight being in COVID. I mean, I went to the eye doctor. I'm like, is something wrong with my eyes? And he said, you know what it is? Your left eye is dry. There's nothing, because I'm thinking, do I have glaucoma, macular degeneration? I mean, so he did all these screenshots. He goes, no, your eyeball is like skin. You know, if it's dry, you put lotion on your skin. He goes, it's also like a sponge when it dries out. He said, just just use these droppers. Do not be shy. And you know, it brought it back. So talking about, you know, staring at screens, lack of sleep, everything stems. You know, a lot of times, you know, I'm certain you see these in your clinic is, I have anxiety, stress, lack of sleep, et cetera, et cetera, et cetera. And sometimes if you just treat the sleep, it's a domino effect. And like, boy, doctor, I feel great again, you know?
So often, John. So, you know, I'm seeing people, I'm giving them this like multi-step plan, right? Like, and always, if they're not sleeping well, achieving restorative sleep is step one. But then there's, you know, so we're going to start usually with THC, you know, at night. And I say that when I say THC, I mean a THC dominant preparation. Some people do really well with CBD for sleep, but other people, it keeps them up. And I'm not sure how to predict that right now. So I start with what's worked for years and is pretty dependable. And then there'll be like step 2 on the plan. Once we have restorative sleep, here's what I want you to do during the day to control whether it's your pain or your anxiety or whatever. And at least half the time they come back and say, like, I just did step 1. I'm just taking it at night, but my mood is so much better the next day. My pain is so much better. My anxiety is gone. It's like, no wonder you weren't sleeping. How is your body supposed to heal? So for health prevention, for disease prevention and health promotion, if somebody is not sleeping, that's probably the most powerful thing they can do. And cannabis is an incredibly useful tool for achieving good sleep.
You must get this all the time. I want the medical part of the plant. I don't want the recreational part of the plant. And I don't want to be high. And I always talk about it, and I'd love to hear your side, but I always say it's like, we're out here in California. My brother's been in the wine business for 20-something years, but I say it's like going and doing wine tasting. You can take a sip of wine and you're perfectly fine. You can drink 3 bottles of wine and you're going to be totally intoxicated. And the same thing with THC. You have minute amount, and I'd like for you to share why a lot of times less is more for the body, but also for the pocketbook. But you can do minute amounts and have some incredible benefits. So can you talk about that?
Absolutely. So people are scared of THC, right? And I think in their mind they build it up as having this kind of like really strong psychedelic type of a mind-altering effect, or maybe it was because when they were in college they sat down and smoked a whole joint and they got really stoned and paranoid. I hear that story all the time. But you're right, that's like drinking 2 bottles, smoking a whole joint when they just maybe needed a sip. But in general, with cannabis and specifically with THC, there's almost always this therapeutic window, which means here's a dose that's going to give you an adverse effect, whether it's getting high or getting tired or confused or whatever it is. And then here's a dose that's going to give you a therapeutic effect. And people can get inside that window. It's almost always possible for someone to have a therapeutic effect without any adverse effect at all. Sometimes we got to get creative about how to achieve that. But for most people, that just comes naturally. And so with my patients, especially with THC, we actually start below the therapeutic dose, because I don't know what that's going to be. They might be a 2 milligram person or a 20 milligram person. Everybody responds differently, but we creep up very slowly. Then we're in the therapeutic window. Sometimes we go up and go over the line and they start getting a side effect, and then we back off a little bit and they're in their sweet spot. So the thing about going over the line is that not only does someone get side effects, they also slowly build tolerance, and it works less and less over time. So they lose those benefits. And to compensate for losing those benefits, they tend to increase the dose, and that works very briefly. And then they lose those benefits again, and the dose escalates, right? And so it gets more expensive. They get less benefits, they get less side effects. But if they turn that around, go actually decrease the dose. So a lot of people, it's just so counterintuitive. Like, wow, I'm using cannabis. It used to work so well. It's not working as well anymore. I'm going to reduce my dose. People don't think like that. Why would they reduce the dose to get stronger benefits? But it absolutely works. If you go down, get inside that therapeutic window, in there's no tolerance building. The same dose can work for years or decades without any loss of efficacy and no side effects. So less very often is more. And this is similar to what I was describing before with obesity, where we don't want to overstimulate our endocannabinoid system. We want to nudge it in the right amount, but if we get too strong on it, it kind of revolts and shuts down.
I like your less is more approach, because that is how Corinne and I found you, actually. We always had that approach with her father of less is more, and people doubted us all the time of, no, you need to blast it, you need to really just go at it. And I said, that's not our mindset. And so we were at the Patients at a Time conference. We were exhibiting, running in, listening to the speakers, exhibiting back and forth. When we finally had a break, and there was this new speaker called Dr. Dustin Sulak speaking, the place was packed. We said, okay, no, everyone was in there. So we went downstairs, because there's no seats in there. First off, we went downstairs just to get a snack and a cup of water or whatever. And they had a screen that was not showing the video, just the audio. And we hear this voice speaking about less is more, microdosing. And Corinne and I looked at each other and said, finally, someone, who is this guy? So we ran upstairs and opened the door and saw you there. And that's after we didn't, we let you be because everyone was bombarding you. But, I think a few days later, we contacted you and said, hey, would you take some time with us? And I think you were in the same room, actually, when you Skyped with Corinne and I. We were at home at that time. And that's, but I do love that less is more approach. And it's unfortunate, let's go back to disease, is a lot of patients come to cannabis as a last resort. Now let me try this conventional. There's nothing wrong with conventional. I'm alive because of conventional. I think a lot of us are alive because of conventional. But can you talk about the benefits? Even well, first off, I don't want to let everyone think that cannabis is the golden pill, the golden ticket. Take this and you're healed. It doesn't work for everybody. It doesn't work the way you want it to work. I've seen it work as fighting cancer, and it didn't work to kill cancer with my wife, Corinne. And she was someone who didn't drink, didn't smoke, stayed healthy, love. And so that's the part that people ask, how do you continue on? And I said that this is our journey. We've seen this plant work. And so, but can you talk about the conventional portion of you can combine and try not to be this last resort?
Absolutely. Well, I think to begin with, a lot of people have this black and white perspective of health, and they think that health only includes wellness. They don't see that there's this cycle of wellness and illness, and that participating in that cycle actually allows us to get healthier. That's part of how we grow and adapt to our environment. Now, our conventional medical system, as I mentioned before, is really just focused on the illness component of that, and trying either to suppress the illness and kind of prevent that cycle from going around and around, or change it in a way that might cause side effects and create another illness. So there's a lot of downsides to it relying on an exclusively conventional approach. But as you mentioned, conventional medicine has so much to offer us, especially when there's an acute problem or a trauma, life-threatening disease. There's a lot of benefit from that. So I see conventional medicine as a necessary but just one aspect of what is good medicine, right? And I think and hopefully our terms will have to change in the future, because what I'm really talking about when I say conventional medicine has another name. It's called allopathic medicine, and it got that name in the early 1900s from the osteopaths and the homeopaths especially, who saw it as, wow, this group of doctors, all they're focused on is disease, and they're really not they're not seeing the whole picture here. So that allopathic approach is essential, but it's really just one component. The broader picture of integrative medicine is, how do we not see it so black and white? How do we not attach ourselves to this is good and this is bad, but actually integrate it together and recognize that conventional medicine, alternative, complementary, all of that's a part of integrative medicine, and that we don't need to overly rely on these gold standard randomized controlled trials that are suitable for FDA approval of therapies. But at the same time, it's not all like woo woo, we're just going to do this because someone thought it was a good idea. Like there's a lot of good science out there that supports and informs our strategies in integrative medicine. So whether it's cannabis or other herbs or lifestyle approaches, I think it's very obvious that for someone who wants to feel great every day, live their life to the fullest, enjoying good health, they're going to need a lot more than what they're getting out of allopathic or so-called conventional medicine. And there's no contraindications. I mean, there's very few drug interactions between cannabis and conventional medications. Conventional treatments that people are doing are a great pair with cannabis. This is almost exactly, almost everybody I see in my practice is coming in on all these different conventional medications and treatments. And cannabis often can substitute or help them decrease their dose of many of them. I mean, we see that all the time. And then people are able to have less side effects and better quality of life, but they are not mutually exclusive by any means.
I share that topic that you have shared numerous times about how you can lower your pharmaceutical drug with cannabis, but still get the same effects as if you were taking, 25, 50 milligrams or whatever your pharmaceutical is. Can you talk about how that works and why that works too?
Yes, absolutely. So think of what's going on inside your body is this incredibly complex web of interactions. You've got all these proteins and enzymes, receptor targets, and then all these different pathways. It's super complex. The problem with conventional medicine and the economics of it is that it's really emphasized what we call monomolecular therapies. These are medications that are made from a single compound, a single molecule. And if you imagine that complex web, that single molecule is usually just pushing one node of that web. So imagine a big spider web, right? You can push one spot and the rest of it's going to distort a little bit, but as soon as you let that off, it's going to snap back to how it was. It really doesn't make sense to try to interact with a complex network by pushing on a single node. In order to affect the whole network, you got to push really hard. Typically, you got to push so hard that you're going to start breaking strands and causing problems elsewhere in the node, right? Elsewhere in the system. That's conventional medicine. Cannabis is like the opposite. Each compound in cannabis has numerous targets, and not to mention there's hundreds of compounds all working together. So now we're talking about thousands of little nudges on the system, all in the right direction, but in different areas. That's how we can affect physiology in a way that's sustainable without so many side effects. And it improves the kind of coherence of the whole system when we address it that way. And so often when I start using cannabis with people, I mean, it's a lot of the things we talked about. Their sleep is improving, their metabolism improving, their flexibility in their thoughts, their flexibility in their behaviors, not to mention their physiologic flexibility is improving. And that allows them to respond better to these monomolecular therapies that are just driving one node. It literally improves the flexibility and the resilience in the entire physiologic system. And so, yeah, we see doses of medications going down, and sometimes people get off them and sometimes they don't. But if it's at a lower dose, they're less likely to get side effects and they're still getting the same benefit.
I love all your description. In you talking, I'm thinking, where did he get all this information? Because like you said, you've only talked about cannabis. I think twice you said in medical school. I mean, a wealth of information. So I love listening to you speak, not only here, of course, on our podcast here, but at all the conventions. And so I appreciate what you do. Can you talk about it? The one thing I always loved, and it's a great description. Another great description is the pain threshold. Again, less is more. Taking in, that body count and seeing where you are. And you always talk. Can you talk about the breathing?
Sure. So, I think this comes from my patients, right? So much of what I've learned is just taught to me by my patients. And one thing that I observed a lot is people coming back, and people with chronic pain, they come back and they say, the pain is a little bit less intense, but there's something else going on here. It's less bothersome. It's like instead of right in front of my face, it's in the back burner and it's not getting in the way of my life, and I'm not anxious about it, and I'm not moaning and groaning about it, according to my wife. Or she'll be sitting right there and say like, yeah, and he's so much more pleasant to be around. He's not moaning and groaning all day, yet the pain is still there. There's also a qualitative research study that came out of Israel that I think was really beautiful, just confirmed a lot of what I saw in my practice. I thought someone must be like sitting in my waiting room planting this phrase in my patients' minds and mouths, because everybody one after another comes in and says, this gave me my life back. I mean, you've heard that, I'm sure, so many times, right? Is that like the key phrase for cannabis? It gave me my life back. The Israeli researchers called it restored self. What they found was when they interviewed people, people tend to feel like after they start cannabis, they feel more like themselves. It gives them a deeper connection with self, even in the absence of changing their other symptoms. So their pain may not have changed, their anxiety may not have changed, but just the fact that they feel more like themselves improves their quality of life. So what I learned from my patients is something that has a name in the pain literature. It's called unbundling. So you think about it like this. You got pain, say in your leg or somewhere like that. That's sending a signal up to the brain. We call that signal nociception. It's not pain yet. It's not pain until it reaches the brain and gets interpreted as pain. Then there's a variety of things that happen. One is attentional fixation to the pain. So people start paying a lot of attention to their pain and less attention to the other things in life that bring them joy and gratitude and happiness. Then there's anxiety, right? About staying in pain. There's this judgment that that's a bad thing, so there's ball of suffering, it's all wrapped together. And cannabis helps them tease that apart layer by layer and recognize, like, wow, there's a sensation. Maybe it's a neutral sensation. Maybe it's good, maybe it's bad, but we don't have to judge it. And because I'm not judging it, it doesn't have to be bothersome. And then it doesn't have to cause anxiety about staying in it. There's so much we can do. And my training in hypnotherapy, that's exactly the hypnotherapy approach to dealing with chronic pain, is to transform it into a less bothersome, more neutral sensation. So a lot of this has to do with being connected to our self-awareness, right? And not being a passive, not passively being influenced by the factors in our life, but actually like having this centeredness and this connection. So one of the things that I work with, that I recommend to all my cannabis using patients, is something called the inner inventory, which is just a way to connect with yourself. You could do it anytime, but it makes especially good sense to do it before and after using cannabis, because it's a way of understanding, has this small dose of cannabis affected me or not? Some people don't even realize that they're feeling better until they check in. So what I have people do is rate on a scale from 1 to 10. Just take a deep breath, and how smooth and easy is that breath? I mean, what an easy thing to do, Wow, you got me going, John. I'm at like an 8 right now. And then the next thing I recommend is body. So hold still for a moment and just check in and see how easy it is for you to be comfortable in this position wherever you are right now. And you can rate that too. I'm like 8 or 9. And then the last one is mood. And so you could ask, like, on a scale from 1 to 10, how authentically content or grateful can I feel right now? What's my sense of appreciation? Or if you don't know how to do that, just put a fake smile on your face, give it a few seconds, and wait and see, like, how real does that fake smile become? And that you could rate that 1 to 10. So just by doing that, we're connecting with ourselves. We're getting a sense of where we're at, and then you could use cannabis in a certain time frame later, check it again. Now, if those numbers have improved, then that cannabis is likely having an effect on you, and you're at a dose that's beginning to be therapeutic. So then wow, I'm like getting into that therapeutic window right there.
Let's start low.
Start below the therapeutic window. Start with a dose that does nothing. There's no harm in that.
And just see where you are. I feel good.
I feel good.
I use that all the time, just for my own personal, let's take your breath in. And even like you said, put that, smile on, even if it's a fake smile, it will change that smile. I mean, it'll change how you feel. But breathing, if you, and I share with a lot of people as well, is just breathe, stop, taking a breath, and that's 1 second of taking in that breath, you're forgetting about all your other noise in your head. And just that 1 second can help. It works for me. Definitely works for me. Pain's a big thing. Like diabetes and obesity. Pain's a big topic here in the U.S. I was talking to a pharmacist yesterday out of Connecticut. Pain was just added to the qualified condition to that list.
Isn't that crazy?
It's amazing. Yeah, it is great, but it's kind of disappointing because there are states that have cancer on the list, but not pain, or have pain on the list and not cancer.
Yeah, the Connecticut program has taken a while to come around for sure.
Started,
They've been very slow.
11 different conditions, where California started with 111 different conditions, and but with that, a lot of people are turning to other pharmaceuticals to treat their pain.
Right.
And that's a whole.
That's created the highest death rate in people under 50 in our country right now. I mean, I won't say that doctors have exclusively caused this opioid crisis, but they're pretty close to it. I mean, somewhere around 80% of people using heroin started on pills that
Yeah.
were prescribed by doctors, dispensed by a pharmacist. Our country consumes about 85% of the world's opioid supply, even though we have only 5% of the world's population. So there's a major problem here. We got hoodwinked. My profession was told that these drugs are safe, and if you're treating chronic pain, they don't build tolerance, and they're not addictive, and so forth. And now we recognize our folly and are backpedaling aggressively. But in the meantime, we've created a terrible epidemic.
Yeah.
And pain, we need good tools to treat pain. I think that's part of it, is they just didn't have cannabis in their toolbox. Like, if they had something that was safer and effective, throughout the 1990s and the 2000s, we would not have been prescribing so many opioids. But there was an absence of cannabis, which should have been there, because it was there in the late 1800s. It was there up until the 1940s. It's an incredible treatment for pain, because of all the things we've talked about. Thankfully, it's coming back into the toolbox now.
And a lot of these doctors are getting, the spotlight's put on, but their hand slapped. And so they're pulling back saying, I cannot give you your medication anymore. And a lot of them are turning to the street to get to find their pain relief, like you said, with cannabis. And it's unfortunate that cannabis was around, it's been around, banned here in I guess became decriminalized in 1937, I believe, about 83 years ago. It's starting to come back. Right now we're 33 states, District of Columbia. Clearly this number is going to be going up. What are your thoughts with the pharmaceutical companies getting involved? GW Pharmaceutical, Epidiolex. Love to hear your thoughts on that, because I have been kind of anti that, having the pharmaceutical companies come in. But dear friend, she's 19, she has autism, she has tried cannabis, but because of the dosing, she couldn't find, it was kind of like a roller coaster.
Yeah.
So her neurologist out here in California said, well, okay, if you really don't approve cannabis, then there's a GW Pharmaceuticals putting out a product that, please write us a prescription. And
Yeah, I think there's a place for it.
it's actually working, and it really changed my whole opinion on that.
Well, good. I'm glad you had that shift. I don't have a great perspective on how the pharmaceutical industry getting involved with this changes regulations. Like, is that going to make it harder for states to allow someone to grow the plant in their backyard? If that's
Probably.
the case, that's a terrible thing, in my opinion.
Yeah.
I think it's a human tragedy that there's still so many people in the world that aren't allowed to put a cannabis seed in their backyard and watch the beautiful thing grow. So I don't know about those broader implications, but strictly from a medical perspective, I absolutely do think that there's a place for prescription and pharmaceutically produced cannabis treatments. I don't want allopathic medicine to have to be excluded from this evolution. I don't want that to be left behind. Now, I have patients that are in nursing homes, that are in group homes. They can't have herbal cannabis there. There's too much red tape and regulations. I can prescribe them THC in a pill. Every pharmacy has THC behind the counter in a pill. Like, I'm so thankful for that.
Do you use I know Dr. Behrman has talked about that on the show, and so do you also do that with, and you're talking Marinol, correct?
Yeah, absolutely. Marinol, or the generic name is dronabinol.
Isn't that amazing though? Isn't that amazing that, nope, you can't use this, but I can write you a prescription for this.
Right. Well, there's a lot of hypocrisy, but yeah. So right now there's 3 agents in the U.S. pharmacies that affect the cannabinoid system directly. One is THC in a pill. One is called nabilone, which it's not used that much, but it's very similar to THC. It's just absorbed better, so we can use less of it. And then the third is this newest one, which is Epidiolex, or it's just a CBD solution. The main difference from that is that it's derived from the plant, and it actually does have trace quantities of some of the other compounds in there. It's not purified CBD. I mean, it's purified a lot, but there are some trace phytoconstituents in there. So I think that these are useful. I think if people have access to them because their insurance pays for it, or because they're in a facility that requires it, or simply because it's the same every time they get it, you like this variability in the world of cannabis is really good for some people, but it also is very hard for some people. You know, they go get the same product with the same label and it's totally different, and that throws off their treatment. That's a big issue for a lot of people.
And that, so cost one, insurance, very helpful for a lot of people because higher doses of cannabis can be expensive. But the one thing is knowing that you're getting consistent, and so that's the one thing I like. And then also, and I have to, do you know if it's because it's scheduled 5 in pharmacies have it? Is it available in all of our states, legal or
Yeah.
not?
Yeah,
So that,
Epidiolex, yeah,
yeah,
every
great.
state.
That's why it's it has been beneficial. It's funny, I contacted them to see if they'd be on the show to talk about this, and I have not heard back. But I would like to get, show both sides of the pros and cons as well.
Absolutely.
And so, with your practice, what do you see? Do you see a lot of pediatrics to geriatrics, or what's your sweet spot?
Oh man, it's such a big mix right now. I feel like it's kind of come full circle and now I'm seeing everything. You know, the first few years of my practice, it was mostly adults with chronic pain and PTSD. Then Sanjay Gupta got on board and suddenly my practice shifted like way towards pediatric neurology. I've been seeing more and more cancer. I think I might have you to thank for that, John. And it just keeps changing. But right now it's a beautiful blend. Every patient is like from a different walk of life, a different specialty field in medicine. It's so exciting for me to have these challenges. You know, I'm learning about rare conditions all the time that I've never even heard of before, because cannabis is like a magnet for all of this stuff that just doesn't respond to conventional therapy. You know, it's amazing. I do want to go back to the health prevention thing because there's a few other things that I think are important to cover.
Yes, and then I would also like to go back to, can you talk about the entourage effect and why combining? And you mentioned in Epidiolex they have some other constituents in there too. And so
Yeah.
if you go back to both of those,
Yeah.
that'd be good.
Yeah, sure. Well, let's start with the entourage effect. So, kind of similar to what I was describing before about hitting the system on multiple nodes with gentle nudges instead of just poking one thing. The term the entourage effect originally described the endocannabinoids because we have these two major endocannabinoids, and then researchers identified all these other ones, and it looks like, well, they're not really hitting the target, but in the presence of the major endocannabinoid, they're modulating how it works. So it's almost like on its own, it does one thing, but when it's got this entourage behind it, it does something slightly different. And then that term was taken and applied to the cannabis plant as well, because same thing is going on there. You know, you've got THC doing something, but THC in the presence of 24 other things that are very similar to THC, it does something a little bit different, and it tends to be more therapeutic. If you look at, I think one of the best examples of this is a review study that looked at treating seizures, which is what we're talking about with CBD, versus, purified CBD versus CBD in the context of a whole plant compound, something that's still mostly just CBD, but it's got all these, hundreds of other little things in it. The average dose is about a third to be effective if you're using the whole plant versus the purified. The adverse effects are way less. Obviously, the cost to
And what is purified definition for you?
like single molecule,
Like
just plain old.
like an isolate.
Yeah, an isolated
Yeah.
CBD, exactly. So like a pharmaceutical grade pure CBD versus something that's mostly CBD in the context of these other compounds. So that's, whether we want to call it the entourage effect, or maybe a more accurate term is phytoconstituent synergy. There's a synergistic effect, right? We could remove the CBD and give that kind of background of all those other compounds. It's not going to do anything. You need the main actor to be part of the picture. But when the main actor is there with the entourage, the effects are stronger, so you need less of it. There's less side effects. And again, think about that broad network that is our body. We're nudging it in all these different ways instead of, focusing on one thing. But so we talked about sleep, we talked about obesity and type 2 diabetes. I think those are probably the areas where cannabis has the best to offer us in terms of promoting health and preventing disease. But there's some other things coming out of literature which are quite exciting. And heart attack, cardiovascular disease is one example. So now we have some data that shows that people who come into the hospital having had a heart attack, if they've got a little cannabis in their system, then they're less likely to die. They're less likely to need an aggressive intervention. And so again, we could say, well, is this just an association, or is there a causal relationship? Is the cannabis actually protecting their heart? And so then we turn to the animal studies, to find out about that. Now you can inject a mouse with the tiniest little dose of THC. I'll have to use the word tiny 10 times in a row to actually describe how low this dose is that they've used in the study. If you inject a tiny amount of THC 2 hours before giving the mouse a heart attack, you limit the damage, about cut the damaged area of the heart in half. Half as much damage, faster recovery, less inflammation. There's absolutely a cardioprotective effect from low doses of THC and likely these other cannabinoids. So just think about it. As people stop using opioids and start sleeping better and becoming less diabetic and all of that stuff, more people are walking around with a little THC and CBD in their system. What does that do to our rates of death related to one of our biggest killers, heart disease? You can look at the same thing with stroke and traumatic brain injury.
Same thing.
So people that come into the hospital after having a traumatic brain injury are less likely to die by a lot, based on the data that we have, if they either have cannabis in their system or admit to being regular cannabis users. Is that a causal association? Well, we've got over 20 animal studies in which we've injured the rodent's brain, and before the injury, given either cannabis or given we don't call it a placebo, it's a vehicle, a control, and clearly the cannabis prevents a large amount of the brain injury in rodents, and it seems to be doing that in humans as well. So some of our biggest,
a dear friend of mine had a fall off of the railing was not there, and they were running, and it was nighttime, and he went off, and he was in Montana, and the doctor said to him, "Are you a cannabis user?" He goes, "Heavily." He goes, "I'm telling you, this saved you," and he's back to normal.
Right. Now, do my cannabis using patients still have heart attacks and strokes? Yes. And does that sometimes kill them? Yes. This isn't 100% like miraculous protective effect, but just think about it from a public health standpoint, because these are some of our biggest killers, right? We're talking about heart attacks, stroke, traumatic brain injury, and then we could talk about cancer. I already touched on this because that I mentioned the rodents who got all this THC every day for 2 years had less of every type of tumor in that group than the untreated rodents. There's not a lot of evidence that people who use cannabis get less cancers, but there is a little bit. And I think the strongest signal is with bladder cancer, which is a fairly common type of cancer. People that smoke tobacco are about twice as likely to get bladder cancer. People that smoke cannabis are about half as likely to get bladder cancer. So that's a great comparison.
Before we go, and I want to talk about your book, what you're doing, but also can you talk about just health and wellness? What would you recommend for your patients?
Yeah, great. So besides sleep, which is just so important, what are some of the main domains of health and wellness? And I think pretty much anyone would next start talking about activity, some type of exercise, or more of an inner activity, whether it's like a yoga qigong or just a meditation. I can put all that in kind of the realm of activity. And then diet, right? What are we putting into our bodies? And maybe it's more than diet. It's what are we putting on our skin, and what medications and things are we taking, and so forth. So, from an activity level, I am absolutely convinced that what people are doing to stay healthy has to be enjoyable and inspiring. It's not going to work if you hate running and you get yourself out of bed and force yourself to go for a run every day. That's stress that you don't need, and it's not going to work. So have fun. It has to be something that you're inspired by and that you love. And so a lot of people, they just don't know what they love. They don't know what their highest values are. Like if you could make a list of everything in your life from most important to least important, what does that list look like? People don't even know where to start. And when they finally do start, they tend to be looking at a list from someone else. It's basically like the people they've admired that have, they've assimilated their lists, or the people they despise and they've taken things, off their list because of that, or what their parents valued, or whatever it is. Like clear that crap away, get to know who you are, and fill your days with things that are congruent with those highest priorities and highest values. And it's pretty easy, because when you do that, you're in the flow. So as I was talking before we started the interview, like one of the new things for me is inline skating. I live out in the country. They just paved all the roads, so they're perfectly smooth. I used to love inline skating when I was in my teens. I haven't done it since then. I bought myself a pair of skates, and I'm just like flying out there. I love it. So when I'm working hard, when my legs feel like they're about to give out, and my heart is pumping, and I'm breathing heavy, I'm into it. This is not torture. This is pure enjoyment for me. So I would encourage everyone to keep looking and find what is the activity that really nurtures their soul. You'll know it when you get there, and you got to fill your days with that. And it's especially useful to have an anchor where every single day you're doing something. It's like a fulcrum, and the rest of your life can kind of organize around that. So if you have a health promoting activity that you're committed to every day, that consistency can make a huge difference.
That has been my therapy. Getting on my bike, and I just forget everything. And, reading articles about cycling, I can't tell you how many cyclists say the same thing. I get on my bike and I just forget. I drive around, like I always tell people, I drive around with like Pee Wee Herman with the biggest smile on my face.
Totally.
That's what it does to me.
Think of Pee Wee Herman, right? He was just doing it for the joy of it. So that when it comes to consumption, I think that there's a lot of diets out there. There's a lot of different things, and some of them work for some people and some work for others, right? There's no one size fits all solution. I think in my practice, what I use way more than telling people what to eat is telling people how to eat. Because when we change how we eat, then we end up we start making different choices about what we're putting in our body. So this is really simple. Anyone can do this. 3 or 4 basic rules. One is, when you sit down with your food, take a deep inhalation, like smell your food, let it get into you, and then do that 3 times. Okay. 3 breaths before your first bite of food will feel like an eternity. It's amazing how people, actually struggle to just sit there and smell their food and take 3 breaths. But what's happening is you're shifting out of fight or flight nervous system into the rest and digest nervous system. You're allowing your gut to turn on and get ready to receive the food, and you're allowing your mind to get into a state where it can really appreciate that food. Okay, the more we appreciate the food, the less we're going to eat. Because I know that sounds totally paradoxical, but step number 2 is to chew your food thoroughly and focus on the savoring, focus on the appreciation of it. So this is a mindfulness practice while eating. Don't get distracted and watch the TV. Little conversation's okay, but let the conversation, kind of happen when you're waiting for the food to be ready, and while you're finishing those last bites and sitting around afterwards. The main part of the meal should be devoted to chewing thoroughly, so you can get all the nutrients out of your food. You don't need to eat more, and to savoring that experience. And basically, you're using the circuitry in your brain of appreciation then 2 or 3 times a day, and you're just going to get better and better at appreciating other things in your life. And you're going to stop when you're full, because you're going slowly and you're savoring and appreciating the food. So, I mean, those couple things are just so paramount to healthy eating. It's what I'm basically talking about is the conscious reception of food. And then you're going to start figuring out, wow, that food doesn't make me feel good. This food does make me feel good, and so forth. I think that, there's a big trend now in fasting. I think that, I fast. I'm a big supporter of this. I've been doing it for years, and I think that it's helpful for a lot of people. So one of the biggest challenges to our health is that we're living in an environment that's just so different from the one we evolved in. Okay, and it's very unusual, it's very recent for humans to have access to calories and carbohydrates year round in abundance. Okay, there would almost always be times when we had less and times when we had more, and times when maybe we had to skip a few meals so that the pregnant women and the children could eat, and not us. I mean, that's nature, right? We're removed from nature. And so I encourage people to see what it's like to be without food a little bit. It's wonderful to have this liberation and this freedom from food. It actually will increase the enjoyment of food and improve your ability to savor it, and it'll dust off that old metabolic equipment. So inside of our cells, we have the ability to burn fat as a fuel source. We have the ability to survive without food for long periods of time, but most of us just haven't used that equipment, and I think it's so useful. So now people are
And
talking.
even getting over that hump of the first day where you're thinking, I'm starving. You'd be surprised on how clear everything is. Your
Oh,
energy level goes up.
the mental
But the
benefits are
best part
incredible.
is inflammation. When you don't have inflammation in the gut, I shared at the beginning of our show here. I went vegan. And I was never really a big meat eater, but in January, for me, I don't miss it at all. My sweet cravings aren't there, but I have zero inflammation on the inside, and it's a good feeling. I mean, it's a good feeling. So I didn't mean to cut you off there in your third step.
Oh, no, no. Well, so it's very practical. People think about fasting like it's millions of years away, but guess what? You do it every night, right? And so this whole idea of time restricted eating or intermittent fasting is growing. If you are comfortable with going 8 hours without a meal, then it's not going to be a big deal for you to go 9. And it's not going to be a big deal after that for you to go 10. And I think if once a week, even as little as just once a week, stretch that out and see if maybe it can be 12 hours without a meal. Maybe it can be 14 or 18. And you can just keep nudging it along, and you'll be amazed. Your body gets used to all sorts of things, right? And I think that's really nice. So metabolic flexibility. It's not that you always want to be fed, or you always want to be fasted, or you always want to be vegan, or you always want to be one thing or another. What's really important, I think, is to be flexible and to cultivate that flexibility. So those are my basics on activity
What
and
do you do? Like,
consumption.
you max out at 24 hours, or you being an expert this, have you gone days?
Yeah, so every week I do about 36 hours of fasting, and at this
Wow.
point it's like no big deal. I have dinner Sunday night.
Yeah.
I enjoy it. I go to work on Monday. I work all day. I'm having liquids. I'm just not having any calories. Also, I don't have any caffeine on my fasting days, and I don't have any cannabis on my fasting days. And so every week I'll go Monday morning to night, just living on my own energy, which is beautiful.
And
And
no
then
headaches. There's a lot of people when they cut out caffeine as well as cannabis, um, uh, headaches arise. Is that
sure. Well, it's something that I've gotten used to, right? So now my body's adjusted. Like none of this is easy at first, and I don't encourage any of the viewers to try this tomorrow. Like you got to work up to it, but your body will get used to it. So then I wake up Tuesday morning. I do an incredibly vigorous workout after having no calories for the previous 36 hours, and it's amazing. I'm wondering where's this energy coming from, but I've just gotten really good at that, and anyone can. And then I break the fast, and I am savoring every bite every week. It's so I have feasting, I have fasting, I have it all, and anybody can and enjoy good health.
good? And then I know our listeners are like on the edge of their seat. Like, come on, Dustin, what cannabis ratios or milligrams should I take as a daily? As you mentioned earlier, people have had success with 1 milligram, 2 milligrams. More is not better. And again, it's not a one size fits all. what works for me might be completely opposite for you, as well as our listeners. So
Yeah.
I truly believe that medical experts should be involved. Either if you're able to contact Dustin, can you share? Do you have anything else to add? Because I want to be courteous to your time as
Oh
well.
yeah, I can absolutely. So just talk about like what does it look like to use cannabis for health promotion? What does that look like for most people? And so I'll just review a couple of the points that we already talked about. Number one, sleep. Okay, so if you're not sleeping, use THC for sleep. That's usually in an oral form because that's better for helping stay asleep. But if you have trouble falling asleep, inhaled can work rapidly and help you fall asleep. And sometimes people need a combination of that. The next one would be connection, right? Connection to self, connection to nature, connection to God. Make it part of your prayer, make it part of your spiritual practice, because in my opinion, cannabis, and in my experience, cannabis can really enhance those experiences. And I just circle back real quick. Like we just found out, researchers just discovered that 2,800 years ago, in a shrine in Israel, in the inner part of the temple where they keep the Torah, there were two pillars. One had cannabis burning on it, the other had frankincense burning on it. Okay, 2,800 years, 800 before Christ. I mean, like, using cannabis to enhance a spiritual experience is nothing new. It's absolutely normal. You can go ahead and do it. You're probably going to feel more connected to God or nature when you do. So those are the starting, those are kind of the pillars: sleep and connection. The other part of connection I didn't mention is social connection, right? So sharing cannabis socially can really help people open up emotionally and talk about the things that are important instead of all the crap that other people tend to talk about when they get together. I think that it kind of helps people get to the heart of it. And all of that is either THC dominant cannabis or some combination of THC and CBD. Then we look at resilience to stress, okay, because we are in a stressful environment. And I think one of the best ways for people to notch up their resilience to stress is to take some CBD with breakfast, or in the morning. And it doesn't agree with everyone, but a lot of people, even a low dose, CBD is kind of weaker than THC. So by low dose, I'm thinking like 5-10 milligrams. For some people, it might be more like 20 or 25 milligrams. And some people need even more than that. But a dose of CBD in the morning tends to help people feel sharp and focused, mentally clear, and more resilient to stress. And it's not just resilient to stress, it changes what might be distress into something that might be that helpful type of stress that's just enough to make us grow and make us get stronger and more clever. But the delivery method of cannabis that I think is the most underrated and untalked about, and it's probably the very best way to use cannabis as a tonic meaning stay healthy, is cannabis tea. And it's so simple, and barely anyone is doing this. So when I talk about cannabis tea, what I'm really talking about are the raw cannabinoids. In their raw form, they're very different than after they've been exposed to heat above a certain temperature, and the boiling water from the tea really just isn't hot enough to do this. So THC is not made in the plant. THCA is made in the plant, right? CBDA is made in the plant, and then those get converted to CBD and THC with time and heat. But the cannabinoid acids, that's just what the A stands for, the THC acid and the CBD acid, these are extremely absorbable into the body, much more than their neutral counterparts. So you don't need much of them. They have great anti-inflammatory effects, and they're non-psychoactive, they're non-impairing. They have pro-metabolic effects, they have anti-cancer effects. We're just starting to learn more and more about them, but they are a potent way to use cannabis to promote health. So what does this look like? Take a little bit of cannabis flower. It doesn't have to be much. I'm talking about like the size of a pea. Throw it in the cup. You could throw another tea bag in there. You could pour your coffee on top of it, or just pour hot water on top of it. It doesn't matter. This stuff is water soluble. It's going to get in there, and you're going to be able to drink enough of it where it has a physiologic effect. It's not immediate. So unlike THC and CBD, where if you take a single dose, you might notice like, wow, I'm getting pain relief, or I'm getting some anxiety relief. It's with the tea, it tends to be cumulative over time. So it's people that are doing it every day. After a week or so, they're like, wow, my joints are feeling better. Oh, my mood's better. I've been like my energy's been better. And it's just so easy. So throw a little bud. If you have the opportunity to get something that's got both CBDA and THCA in it. So it's one of these varieties of cannabis that kind of has it all. Or you could put a little pinch of THC dominant flower and a little pinch of CBD dominant flower. But I encourage the listeners to try this if they have the opportunity to drink cannabis tea once or twice a day for a couple weeks and see how they feel. It's incredible.
I'm going to try that too, because there are if you don't have a plant, a lot of people don't have plants in their backyard or flower. They do make tinctures. Are you a fan of the tinctures? The THCA tinctures and the CBDA tinctures?
Yeah, they're hard to make, honestly. Yeah. Like that's one of the things that I've been working on with Healer, which is a company that I didn't have a chance. Yes. Okay. So I'll talk about Healer real quick, but that was one of the so Healer's a company that I helped found and that I'm a major part of, and we've just been tackling challenges in cannabis. One big challenge is patient education, like you, John. It's still a challenge, but we've made great strides in that area to help empower people whose doctors aren't telling them how to use cannabis to figure it out on their own and get great results. And then Healer's also tackled the problem of bud tender, dispensary agent, industry professional education, because that's another thing. Like people walking into the dispensary, their doctors told them nothing about how to use cannabis, and now suddenly someone at the counter who has no clinical training is responsible for managing this complex disease. That's not fair. I felt for those people, and they're people that need help, and so I've developed a training program for bud tenders, caregivers, dispensary agents, and industry professionals. That's paid. That's on healer.com. It's modest price, and it's a ton of great content with updates every month. The patient education material is free. And then the third thing that Healer has been focusing on for the last several years is how to extract the compounds from cannabis in a very efficient way and get all of that into a product, whether it's a tincture bottle or whatever, in a way that it does not necessarily require the use of heat or high pressure, because these cannabinoid acids are so valuable to me, and I want to maintain them. I basically want to take everything that's in the flower and get it into a bottle in a way where it's unscathed and in its natural form. And so we've been able to do that using a very efficient and low-cost system where ethanol is the solvent we're using for extraction, but we've discovered how to use some equipment from other industries like nanofilters from the water industry and a few other things to basically clean up the cannabis and remove proteins and allergens and contaminants, and to maintain that picture of that range of compounds of cannabinoids, terpenoids, flavonoids, and so forth, and get that into the bottle. So I know that making a THCA tincture or oil is very challenging. I think we have a great way of doing it, and I think some other people are probably getting close, but probably a lot of them it's not quite what they think it is.
We did this with Corinna. We've done this over the years as well for our listeners too. It's very similar, like wheatgrass juicing. You can pull the plant. The A is for acid, not like psychedelic LSD acid, but the raw form, and you're able to juice it just like you would wheatgrass. Non-psychoactive, as Dustin was sharing, great for inflammation, great as a cancer fighter. And I truly feel that this is the next. THC was there. Everyone had heard about CBD.
Right. Oh yeah.
And I'm surprised THC has not, because for the last 4 or 5 plus years, 6 years, people have been talking about it. And I'm surprised it's not as prominent as CBD and the others. And I really know I know you have another.
Well, no, that's all right. I'm enjoying this so much. Look, I'm good at skipping meals. So if I have to get to my next call without lunch, it's fine. But just for the listeners that are interested in these cannabinoid acids, I just want to make one thing clear. THC and THCA are drastically different in how they work in the body. THCA does not hit the cannabinoid receptors. It really doesn't seem like it does any of the same things that THC does, or maybe a few, but not that many. CBDA, on the other hand, is very similar to CBD, except that it's absorbed much better and it's a lot more potent in many ways. And the one major difference that we know about is that right now, so a lot of people use CBD for the purpose of turning down the intensity of THC, right? If they want to use THC therapeutically, but it's too strong psychoactively, you can add some CBD to the THC and it's going to be less psychoactive, less impairing, but maintain that kind of therapeutic level typically. So some people want to use CBD to turn down the volume of the THC. CBDA does not seem to do that. It doesn't affect the CB1 receptor. So it shows up to me as a great substitute for CBD in many ways, because you can probably use less of it, have a stronger effect, have better absorption, and not mitigate the power of THC, because some people don't want to mitigate the power of THC. They want that power to be fully pronounced. So I think, yeah, like you were saying, CBD is the big thing now. I think pretty soon we're going to see CBDA being the big thing. And for listeners that are interested, Healer is about to launch a product line that has hemp-derived CBD and hemp-derived CBDA. So we are taking organically grown, beautiful hemp flowers and essentially getting everything that's in there without any exposure to heat or pressure, and getting that in the bottle as CBDA. And I'll be very interested to see how much people like that and how they think it compares to regular CBD.
If we had more time, I was hoping to get into that too, but we can take that when you launch, and we can talk about because a lot of this topic comes up. CBD is CBD, CBD is CBD, because a lot of people think, okay, I want cannabis CBD, not hemp CBD. And I've been educated over the last few years of the benefits of this hemp plant as well. And so next conversation, but let's talk about your book, and then I'll let you go.
Okay, so the third thing that I'm not working on directly with Healer, but obviously like one of the major bottlenecks in cannabis being able to fully embody its health effects onto our planet and onto our population is the lack of knowledge of clinicians in the healthcare world. And it's just a tragedy that they have not been taught about this incredibly versatile tool that's so safe and so effective. And so this has been a major passion of mine, to educate healthcare providers. And for the last year and a half, I have been writing a manuscript for a book that's dedicated to clinicians. It's going to be an extremely accessible, useful reference guide for anyone, whether their entire practice is devoted to cannabis or whether they're in some other field and they just want to know a little bit about how one of their patients might be able to better use cannabis. So that's coming out in October. It's available for pre-order now. If you Google my name or search it on Amazon or somewhere like that, you'll be able to find the book, and a great gift for your primary care provider or one of your other healthcare providers. Please help them out. It's a modest price on it as well.
A great gift, for going back to work. Here, welcome back, doctor. And also, you do have doctors that come out to Maine and mirror you in your practice, which I think is very beneficial for doctors and physicians that want to learn hands-on training about cannabis, how to, each patient's different. And so can you talk about that, and how can they get a hold of you? How about, that's probably the best way.
Yeah, absolutely. So go through healer.com. So basically inside this program, so I developed a program for dispensary agents and bud tenders, right? That's who it was really intended for. And I thought, well, some industry professionals and some really dedicated patients and probably some caregivers of patients are going to join and check it out. And then, I didn't plan it this way, but we have over 100 clinicians in that program as well. So then I felt the need to offer them more. And so there's some clinical training that's a part of that broader curriculum that just those clinicians get. And the people that go through that are then invited to come out to Maine and hang out with me in the office and see some patients together. So if you're interested, go through the Healer training program, go through the clinical aspect, and then you're totally welcome to come see patients with me, and we have a lot of fun.
Awesome, Dustin. Well, Dustin, I appreciate your time. You want them to go to your website? Do you want to go to your phone number? What would you like to do?
Yeah, healer.com is the best way to find me. And if you send a message to info@healer.com or the contact us thing, then you can get me. And thank you so much, John. You're doing amazing work.
Yeah.
You got me going really well today, and I appreciate that.
Well, you're ready for your next call as well. And Dustin, thanks so much for being on as always, and you're always supportive for what I'm doing here in all the ventures and journey that we're on together. So, Dustin Sulak, everybody, and you can find him at healer.com. This is John Malanca with the United Patients Group. Be informed and be well. We'll see you soon. Bye-bye. Hey everybody, John Malanca with United Patients Group. Be informed and be well. This segment is brought to you by Aspen Green. Aspen Green is just a handful of USDA, that's right, USDA certified organic hemp and CBD brands. And all of its hemp is grown from the perfect topography and climate found in Colorado. It is a family-owned business and is deeply committed to the science of providing only the purest hemp and CBD products for the best results and most beneficial experience. Its mission is to bring the therapeutic value of pure, organic hemp and CBD to people who seek supplemental relief through the use of healthy, natural products. Aspen Green is free from toxins and runs up to 8 different lab tests from bona fide third-party labs throughout its product line. It holds in high regard 3 foundational principles that guide every aspect of their business, actions, and interactions with their customers, partners, as well as their community. These are quality, integrity, and transparency. These will always remain at the hearts of their efforts to bring their beneficial products to consumers. Check out why purity matters at aspengreen.com and follow them on social channels at Aspen Green CBD. Use promo code UPGCBD for 20% off. Again, UPGCBD for 20% off at aspengreen.com.